This is a relay project.
Real Talk starts right now. Here's Ryan Jesperson.
We've been looking forward to this episode for a long time, and we're grateful to have you here with us. Whether you're watching us on the Real Talk live stream on YouTube, maybe you're catching this on LinkedIn, maybe you're listening to this on the podcast. It could be 6 months after we record it. However you have found us, we're grateful to have you here with the doctors in the house. This episode's going to feel a little bit different than some. I'm sure that it could and probably will get a little bit political. And of course, we'll be touching on the news cycle and referencing some things that are happening all around us as we make our way through the back half of this summer and toward the back to school or fall season. But we've had this episode circled on our calendars for quite some time. That is because the dynamic duo behind the Doc Talk podcast, you've heard them before, Dr. Shazma, Dr. Sheila, on this show, have never actually been able to join us in person together up until now. Yeah, that's right. Dr. Sheila Wijayasinghe and her family have made their way to Western Canada, and you, alongside your podcasting partner, Dr. Shazma Mithani, have so graciously agreed to give us a portion of a morning on your summer vacation. It doesn't get any more generous than that. Welcome to the studio.
Thank you. I'm thrilled to be here. It's awesome.
It's hard for me to wrap my mind around the fact that the first time we had the two of you here together on the show, you were just launching this podcast. Mm-hmm. This was an idea with a bit of a brand and a big idea behind it, and now here you are celebrating the wrap, the conclusion of season 1 and looking ahead to season 2. How are you wrapping your minds around it?
It's been wild, but so awesome. Yeah, Sheila and I 2 years ago met for coffee when she was in Edmonton, and we're just chatting about this idea that we had, like, maybe one day we should start a podcast. And then a year later we did, and now here we are after our first season, like successful first season is wrapped up, and we're already looking forward to and planning for season 2.
Yeah, we've seen you on national shows, and you're mixing and mingling with the who's who in broadcasting and everybody, it seems. All of these talk shows across the country looking to the two of you to kind of provide, I guess, insightful and credible and common sense medical analysis, medical advice.
Totally. That's our goal, right? And we've had such a great response from the public, and they send us their questions and we answer them in a way that, like, there's no secrets in medicine. Like, we want to share what is evidence-based, helpful, because it's hard to navigate our system, and it's been such a joy to do this with Shaz. And from her perspective as an emerge doc and my perspective as a family doc, it just gives us that, and we get the cross-country approach too, which is beautiful.
I love that you do that. For people that might be hearing from you or learning of you for the very first time in this episode, Dr. Sheila, you're a family doc. I like mentioning that you're Alberta schooled, and you're now plying. You grew up in Alberta. You're now plying your trade. You're a family practitioner in the Big Smoke in the city of Toronto.
So I went to medical school here and residency. I started in Toronto and ended up meeting my husband and staying.
He convinced you to stay.
He convinced me to stay.
Yeah.
But yes, I am
first,
Alberta.
not the last.
Like, my heart is here. I worked here after graduation. I loved being here as a family doctor as well. And it just felt like such a great fit to be able to be back in our community here.
Right on. And Dr. Shazma, of course, a well-known, not just in Alberta, but I think across the country, in large part due to your significant social media presence, your advocacy, but also an ER doc at the Royal Alexandra, which is one of Western Canada's busiest ERs, at the Stollery Children's Hospital as well. And I bumbled this last week when I was promoting your appearance here on the show. I was trying to remember, you have a title at the University of Alberta. Are you like a sessional instructor or something like that? What do you do there?
I'm an associate clinical professor there.
Okay, so what does that mean, by the way?
So basically it means that it's like the teaching track where I do teaching with undergrads and with residents and in the medical school. And there are different levels as you have more experience and then have more ability to demonstrate your contribution to the university. There's like a tiered promotional system.
Right.
So.
You also kind of get an inside look. You get the inside scoop on the medical practitioners and professionals of today and tomorrow, huh?
That being able to kind of circle back and give back and connect with medical students and residents is a really fulfilling experience and part of being able to do medicine, because I get to see what's up and coming and get to see, it sounds cheesy, but get to see what the future is going to look like. And it feels bright, and it's nice to actually be reminded of that every once in a while. We're in like the depths of the emerge, like trying to just like struggle through the day or struggle through the shift, being able to have a learner with me on shift or being able to, you know, go and teach the next day. It really is, it gives some optimism.
Yeah, we're going to get, by the way, to like the E. coli outbreak and the Salmonella outbreak, and we're going to talk about a bunch of stuff in the news, but just, you know, enjoy, by the way, just kind of like shooting the breeze with the two of you and catching up. I'm curious to know, this is a bit of a pessimistic comment I'm about to make. This is a glass half empty comment, but you'll have to forgive me for it. But in both of our professions, in sort of the traditional, like the fourth estate or journalism, what have you, when you look at young people, and I'm always so encouraged to meet these young people that are considering a career in it, but it's tough to get a sense of what a career might look like in 5 or 10 years from now. And so when you're sort of like trying to provide some advice or guidance or counsel or even share your own story, sometimes it's difficult to do so. And part of you deep down inside wants to say, if you're looking for stability, maybe you should do something else. Although we want to draw and attract the best possible people to the profession, don't we? Is it the same with medicine right now?
Yeah, absolutely. And I agree with Shaz. Like, I am a teacher as well at the University of Toronto, and the future is so bright. But the learners that we have are so innovative because they're seeing the challenges that we see in healthcare and looking for options. So one of my residents actually created an AI scribe to help reduce the burnout that comes with medicine in terms of our paperwork that we end up doing. And they're creating this on the side of being residents. Like, their capacity to do this kind of work is really beautiful. They connect well with patients. They're really committed to our patients, but they're also really committed to making sure that the burnout levels are lower than what they're seeing in our colleagues right now, and finding really innovative ways of being doctors while also having this other side of life, which is really fascinating.
And I would say that, like, I learned so much from our future doctors and future residents because of their innovative perspective, and just reminding me of, you know, going back down to roots and where you began. It's really, eye-opening, and it teaches me a lot too.
It makes you fall back in love with medicine.
Yeah.
Like, I love teaching for that reason, because it gives you this new, fresh perspective. Like, I'm 20 years into practice right now. It's good, but there's hard days. And then when I teach, it just kind of lifts things back up.
Is there, I'm curious to ask you about, you do med school, you complete your undergrad and med school in Alberta. Dr. Shazma obviously practicing here, but you're practicing out in Toronto. Yeah. Interesting story reported by City News. Obviously, this sucks, I guess, if you live in the eastern part of the country. Atlantic Canadians living longer, which is good news statistically, but with poorer health. The physical health of Atlantic Canadians, the worst in the country, reports Natasha O'Neill, because of chronic conditions that are plaguing people. This data from the Atlantic Economic Council, which uses numbers from the Public Health Agency of Canada. They take a look at population, inflation data, healthcare spending, and of course, across the 4 Atlantic provinces, you look at these poor health conditions. They report that it affects more than half of the people living there. That people on the East Coast physically worse off than anywhere else in the country. It says Patrick Brandon, the lead on this research, there's an important relationship between health, our healthcare system, and the economy. I know that a lot of people will say, well, you can't spend your way to a better healthcare system, but this would suggest that you can certainly invest and see dividends.
100%. And this is such an interesting, I think our colleagues out in the East Coast and in the provinces, in the Atlantic and Maritime provinces, do really emphasize that this is a different type of medicine that they're seeing. They have poor health outcomes. Their chronic disease levels are higher than the rest of the country. They have an older population as well, which is why we do see that chronic diseases. So it's chronic disease and the mental health that were really addressed in that report. And it's tricky because a lot of the population live in rural areas. And Ryan, your dad is a family, like a
That's
rural
right,
family
yeah.
doc, right? And so, like, you know firsthand the impact of access to care is more difficult in those settings. And so they've done some really innovative things in the Maritimes in terms of covering telemedicine options to allow people more access to virtual care, which is one of the benefits of the pandemic, was that we were able to see that it's possible to do virtual care. But there's still these gaps that exist. And one of the things that they addressed in that report was looking at, lifestyle issues are really part of chronic disease management, and they saw smoking was higher in that population, alcohol use was higher, and that does certainly contribute to things like high blood pressure, heart disease, stroke, and other things. And so addressing those things while also addressing the economics of this and people's socioeconomic status, because we know that that is the key determinant of health in family medicine, and it emerged as we see the impact of poverty on our health care and our access to care. And in our own clinic, we have an income support person that helps our patients navigate and do their taxes and make sure that their income is there as part of our healthcare team, because we recognize that income is such an important part of healthcare outcomes.
That's Dr. Sheila Wijayasinghe joining us alongside Dr. Shazma Mithani in our feature interview presented by Mercedes-Benz Edmonton West, both of them co-hosts of the Doc Talk podcast. In Atlantic Canada, obesity, also more common than anywhere else in the country. 42% of respondents to the survey obese in 2023 versus 30% nationally. That's a pretty significant jump.
It is. And I think that, as Sheila was kind of saying, it's easy for people not in health to think about health as like a single entity. But when you take a step back, and I'm glad this came from an economic perspective, because it really shows that there are so many facets that are contributing to health. And so Sheila kind of mentioned the social determinants of health, which is probably a term that people have heard a lot before, but don't really necessarily understand what it means. But it's not just, what is happening in your body that affects how quote unquote healthy you are. How much money are you making? Like what is your socioeconomic status? What is the access to education that you have in your community? What is the access to fresh food and produce that you have, right? Like this concept of food deserts, where people don't necessarily have access to food that is better for their bodies. The education piece, what are the right foods to eat? How can you make sure to be putting the things that your body needs into your body? What are like preventative health, right? So smoking is bad. Alcohol use is not great for your body either, but we take those things for granted because we know those things, right? But not everybody has access to that education to help them understand what is going to help improve their overall health. And then, Sheila is a family doctor. And so when we talk about things like obesity, high blood pressure, high cholesterol, these are all things that require a multifaceted approach in primary and preventative care to be able to manage and improve. And when people don't have access to family doctors and primary care to manage their obesity, have access to a dietitian to help, have access to food education, have access to medications that can treat their high blood pressure and high cholesterol, access to smoking cessation resources, the list goes on and on, right? These are all things that not everybody actually has access to, and then can lead to situations like this where there are poorer health outcomes in an overall population.
You're talking about smoking cessation resources. Are any of your patients using these Zonix or Zins, these like lip pillows everybody's calling them? I'm seeing them more than I've ever seen them before.
Yeah.
I think it's inaccurate. Some people are kind of comparing them to chewing tobacco. I don't think so at all.
No,
they're quite different. What are your thoughts on these? I see them almost everywhere now, it seems.
I don't have a lot of patients who do use that.
No?
But we don't have a ton of great evidence for using that. We have very validated tools that work well for smoking cessation, like we have medications, we have the nicotine replacement gums and patches and otherwise, and counseling has been found to actually be very helpful. And even just like your family doctor or healthcare provider asking you, have you considered quitting because of the health impact, makes a difference. So I'm always really cautious, asking the question. So even in the Emerge, Shaz, when you're seeing somebody who has smoking related complications to something, asking that question has been found to make a difference to care and getting that thought. Now, many people are pre-contemplative, like they haven't thought about it, but just planting that seed can be helpful. So
it seems like anecdotally, fewer and fewer people are smoking. It seems like fewer and fewer young people are smoking. Do you agree? You're looking at me like you're not sold on it.
Oh, no, I absolutely agree. However,
there's a bit of a bump now.
Yes. So I would say fewer and fewer people are smoking cigarettes, but I would say that anecdotally, and even just in what I see in the numbers in Emerge, way more people are vaping, which like in and of itself has its own negative health consequences.
Okay. We're actually, Dr. Mark Tyndall is joining us tomorrow. Which I'm very much looking forward to this. He's a professor of medicine at the University of British Columbia. He actually heard, you can check it out now. I'm just showing drmarktyndall.com on my screen. He's like does TED Talks the whole 9 yards. Somehow, I think it was like our YouTube short or one of our Instagram posts or something. Johnny, producer of the show, and I were talking about vaping. It was kind of a casual conversation, looping in the audience in our Real Talk live chat, etc. He somehow saw it and reached out to the show, and he's like, he's basically didn't accuse us of misinformation, but he was like, there's a lot of things about vaping that people either don't know or aren't talking about. So we thought these would be good back-to-back jacks with you two and then him. So we'll be talking about vaping tomorrow. You can't talk about regional health and regional health stories this summer season across the country without talking about Alberta. About 3 weeks from the time that we're recording this episode, as you can see here, reported by the CBC. I'm not laughing because it's funny. I'm just laughing because it's so shocking and embarrassing. What a tough look for this province. A have province, a prosperous province, an innovative and smart province for the most part. Alberta's measles outbreak surpassed case counts in July for the entire United States. Approximately 5 million people living in Alberta, about 350 million living in the United States. Alberta was looking at more than 1,300 cases about 3 weeks ago. If looks could talk, I don't know what your face would be saying on the podcast right now, but try to put it into words.
It's just so sad and disappointing. Like, honestly, things like this, you know, at the beginning of the episode, we talked about how it's so great to see that the future is bright because there are disheartening moments like this for us as doctors. It is so challenging at times like this to know as a healthcare provider and a scientist how safe and effective measles vaccines are, and we are constantly as health professionals against this wall of myths and disinformation that now unfortunately elected officials are buying into as well. Or pandering to. And as far as I'm concerned, like, the health of Albertans and Canadians should be paramount, and we should not be letting, when it comes to science, we should not be letting alternate views come into play. We should follow the evidence, and that is what our leaders, like, they're leading us. That is what our leaders should be putting out there for us. This is something that has been and will continue to be preventable. And yeah, I mean, we're seeing over 1,000 cases. We're at risk of losing our eradication status. And it just doesn't have to be this way.
And is it maybe not just measles? Like, when you start talking about this, if there's vaccine hesitancy, because that's what this is, there's been some interesting narratives that I've seen fact checkers try to get on top of, do their best to get on top of through the summer. I know that a lot of people were trying to pin, the measles outbreak, for example, on new Canadians. Always a convenient target. You're shaking your head. Do you know for a fact? Otherwise, I know that when you look at the communities that have been affected, it's pretty obvious what's going on. Yeah, when you look at the communities that have been affected, it's not new Canadians, right? It's people that have been in Alberta for a long time. And, I think bringing up the concept of vaccine hesitancy is really important because part of it is disinformation, so like deliberate information that is false. But the other part of it is misinformation, which in contrast is people getting information that they feel is accurate, that they think is accurate, and then taking it in and sharing it with their friends and family. And I think that is a big part of what is happening here with the measles outbreak. And unfortunately, from decades ago, we are still having impacts of disinformation, false data that was put out to start to make people question the efficacy of vaccines, and we are continuing to see the impacts of that. And I don't blame people for being concerned and confused about this because of the immense wealth of information that is out there. Some of it is accurate, some of it isn't. Yeah. And that's why Sheila and I are here, with you on our social media platforms, with our podcast, to help be able to be reliable sources of information for people. Do you have, listen, I mean, it's always interesting when you do a show like this, because I sit here and I profess my love for Alberta all the time. And then every once in a while, if you're being honest, you look introspectively, which be probably the case anywhere you live, based on different factors, different circumstances. But I sometimes look and I go, geez, you just sort of feel like the rest of the country's kind of smirking, chuckling at us. And then there's times where I go, we're the envy of the rest of the country, right? Yeah. This is one of those times that was sort of tough to watch, the measles thing, where you go, this province, not Canada, this province is surpassing the case count for the United States. Yeah. Meantime, in Ontario, in the heart of downtown Toronto, is this an issue or not at all?
Absolutely. It still is an issue in Ontario. It's an issue in BC. It's across the country that there's pockets where people are not being vaccinated or they're under-vaccinated. And so it's not just an Alberta issue. This is a countrywide issue that's happening. And I personally, and Shaz as well, like, we don't want to see other things come back. Ryan, you mentioned early on, it's not just measles we're thinking about. Like, we're worried about polio. We're worried about these things that have been eradicated, that in other countries where they still see these diseases and see the impact of these diseases, they are lining up to get these vaccines because they know it's safe and it's the only way that their kids are going to be able to walk and to survive. And this is where we need to, like, we just haven't seen these things. And so I'd really much rather not see polio come back.
Same.
We are seeing measles now. Like, these are things that Shaz and I have never seen in practice because we did such a great job of vaccinating and supporting our populations and doing our due diligence as a community as a whole to be vaccinated. And the hopeful part of this story is that as a family doctor, because in Alberta, I know you have the public health units that give out vaccines, but in Ontario, we give it out in our offices. A lot of my patients who were not being vaccinated before are coming in now to get their vaccine.
That's interesting.
And so I think it's because they're seeing this shift. And so we certainly hear the scary part about the numbers rising, but I'm also seeing proactive moves by patients and their families to come in and get vaccinated responsibly.
I mean, talking in Alberta about some of the vaccines being, I mean, I guess the dramatic word to use, maybe it's accurate, is being defunded. There was some pressure to like pull away support or at least decrease the number of locations where certain vaccines for kids were available. Have you seen that have negative connotations or negative translations in Alberta ERs?
I think that like it speaks to the broader issue of just access to health and health resources, which vaccines are a big important part of. And so if we are limiting how easy it is to have people be vaccinated, we will have less people vaccinated. It's simple. Like, there's lots of data to show that in terms of access to health resources, and consolidating things like only in cities or only in certain parts of places where people have to then travel to go and get access to vaccines or access to other forms of healthcare. That is a barrier. Like, even people who are with, right, like us, that we're well educated, we have lots of resources at our disposal, even like that would be a barrier for all of us, no matter what walk of life we're in. I think we should be focusing on trying to make things more accessible rather than consolidating things and putting more barriers up.
Yeah, well said. I want to ask the two of you about when you talk about some of the items in the news or the health stories in the news. E. coli and Salmonella outbreaks are both pretty prominent right now, and obviously this is a nightmare for the people that are experiencing the symptoms. In the circumstances where restaurants are involved, you always kind of feel for them, at least in most circumstances, unless they brought it upon themselves. We thought that maybe we'd get into some tips and things to keep in mind with these two, Dr. Shazma, Dr. Sheila, co-hosts of the very popular The Doc Talk podcast. You can find it on Apple Podcasts, Spotify, wherever you get your podcasts. Go ahead and give them a subscribe today if you don't already. Make sure you rate their podcast as well. That really helps. Before we get back to the two doctors, I want to let you know that these conversations happen on Real Talk with the support of our incredible partners like California Closets. This is a proudly Canadian-owned business. As a matter of fact, proudly operating out of their headquarters in Alberta, which is where they manufacture all of their installations. You know, they source everything that they build as close to Alberta as possible. And with that confidence in the product that they're building and installing comes a lifetime guarantee. So whether you're transforming your laundry room, your boot room, maybe a beautiful entertainment center right in the heart of your home, or that walk-in closet you've always dreamed of, you can do it with the confidence knowing that it's an investment made forever. You can request that free consultation, chat with their designers, get a sense of what the budget could look like. They can work with any budget. And that all starts with a visit to CaliforniaClosets.ca. Custom designed to fit your space, your budget. It's California Closets of Canada. Our friends at Friesen Brothers are ready to welcome you to one of their 16 Alberta locations. If you're entertaining out-of-towners like we were this weekend, family in from beautiful Winnipeg, Manitoba, what do you think we did? We went and we saw the butchers at Friesen Brothers. We said we're going to need some custom cuts. So we had Alberta AAA T-bones hitting the grill last night with that world-famous Friesen Brothers warm potato salad. I won't tell you many things will change your life, friends. But subscribing to Real Talk, subscribing to the Doc Talk, and Friesen Brothers warm potato salad. Those are the big three that'll change your life this week. You can learn more about it. Find them online at Friesen.com. That's Freson.com. Don't forget, your next day to save 15% off grocery purchases of $75 or more coming up on the 1st of September. And as you're making your way through this summer as a successful entrepreneur, a successful professional, are you taking the time to maybe pause and reflect on your career goals, maybe your retirement goals? At North Road Investment Council, they're working with Canadians who have done just that, building successful careers, but now you want to make sure that your wealth is being organized to deliver a successful retirement. And that's why the team at North Road works with oftentimes analytical, detail-driven professionals, engineers, architects, dentists, the typical client with about $2 million in investable assets looking for a steady hand and a studied voice. You can learn more about what makes North Road different, including their digital risk advisory services on their website. That's northroadic.com. Today is the perfect day to start a conversation built on clarity, discipline, and true alignment with North Road Investment Council. Dr. Sheila Wijayasinghe, Dr. Shazma Mithani, co-host of the Doc Talk podcast, our guests in studio. We've got some friends here in our live chat, powered by Park Power, talking about vaping and how it helped them quit smoking. Mark says it helped me quit smoking. Yeah. Others are saying, I love this one from Tony, who basically says, Tony says she quit smoking cold turkey. Says the first week was absolutely brutal. She says, I was literally crying into my pillow every single night. She said, but I never wavered. She says 25 years now, and the best decision she made, quitting smoking. Amazing, eh?
It's such a difficult thing to quit. And I have many of my patients will stop and start and stop and start.
Yeah.
It's remarkable what reverses in your body when you stop. And it's like within the first little while, your lung function improves, your risk of cancer decreases significantly. But it's such a difficult thing to do. So I commend these individuals who are like doing it. Cold turkey is often a way that people do it. Vaping is sort of like the step down and then stopping. So there are different ways. You just need that guidance sometimes and support, and the people around you to rally around you, because it is one of the hardest things to do.
I feel like vaping can be the gateway out of smoking and also the gateway into smoking.
Absolutely.
It's kind of like a ramp that can be used both ways, right?
Yeah.
Like for people for whom, a lot of people love cigarettes, like they just absolutely love cigarettes, and vaping will be a different experience for them, help them or not. Other people absolutely can't stand cigarettes. But the vaping experience can be kind of nice. And then the next thing you know, you're building this habit of inhaling, exhaling, and then the next thing you know, there you go. What do you guys think is if we were to look at, I was born late 70s, so I'll call myself a child of the 80s, let's say. But it wasn't unusual to see, parents smoking in the car, not mine, but, some parents smoking in the car with kids. The generation before that, they make jokes how there were like no seatbelts in the back. The kids had no seatbelts. Dad had like a rum and Coke behind the, drunk driving wasn't even illegal until like the late 1960s. What's like the smoking of today?
Alcohol.
Yeah?
I think so.
100%.
Yeah, 100%.
Okay, let's go there.
Yep. So I just saw something go by on my
You didn't even think about that for 2 seconds. You just answered that immediately.
Yep, absolutely. So I am definitely seeing, I was born in the 80s, so I saw something scroll by, and to be honest, I didn't fact check it, but it certainly resonated that millennials are the most, the drunkest generation, or the drunkest cohort. I believe that. I mean, if we think about, when we were growing up in undergrad, in med school, like alcohol is just a staple. Like it is the staple legal drug for our generation. Even when we, go out or come home from work, it is a widely accepted kind of thing to just like have a glass of wine after work, or you go out for dinner, you have a glass of wine, have a cocktail. Whereas I'm certainly seeing, I work in pediatrics and in adult medicine, more and more individuals that are kind of Gen Z and younger are just choosing not to drink at all. Like, no, like and it is much more widely acceptable to just say, yeah, I don't drink. And that's just how it is. And I love that. I love seeing that. We know that the risks of alcohol, even like 1 or 2 drinks a week, can have negative impacts on your long term. Actually, yes. Yep. Like I think it's for
the new guidelines came out.
The new guidance came out, and it's more than 2 drinks a week can have negative impacts on your multiple risks of cancer. So breast cancer, thyroid cancer, colon cancer can increase your risk. The previous guidelines prior to that, the thing that we often think about is 7 drinks a week for women and 14 for men. That has to do with your cardiovascular risk, so heart disease and stroke. But now we have lots of data to show that alcohol has much broader reaching impacts than just your cardiovascular health. It can have, again, even just 2 drinks a week it can increase your risk of many, many different types of cancers.
Yeah, so the guidelines just changed a couple of years ago to say the 2-drink is sort of the recommendation and under. And they describe it really on a continuum of risk. So they say, less than 2 weeks is sort of the lowest risk, moderate risk is up to like 7 drinks a week, and above that, there's like this continuum of risk that goes from there. And it's not to say like it's something that's very difficult for people to bring up in my office, but I always ask about it because it's not a moral issue. It's really a health issue where we see if you go above that 2-drink minimum, then we start to see the increase, like you said, Shaz, in breast cancer risk goes up significantly. And we see the liver cancer, the thyroid cancer, and otherwise. It's really the cancer-related risk that guideline then is why that guideline
When
changed.
you're saying 2 drinks, you're talking 2 drinks a week.
Yes.
Like there's people that are having like 50 drinks a week.
Yeah.
Right?
Yeah.
People having 75 drinks a week. Like,
Yeah.
and people don't typically, like, it's one of those things. I don't know if I'd compare it to anything else. Maybe your weight. I don't know. People don't really like to say out loud how many drinks they think they have a week. Have you ever been through that exercise?
Absolutely.
Like on the hill at Folk Fest
in
or somebody's
medical school.
casually
On the hill
talking?
at Folk Fest, or even in med school when we are asked about like when we're taught history taking skills, and you ask like how many drinks does someone have a week, and they'll say a number, 2, 3, but then the next question is you ask them how big their serving is, because that is also another thing that either deliberately or not, people end up having more alcohol than what the guidelines are, right? Because I mean, when you think about a glass of wine, it's what 5 ounces is for like considered a standard drink. 1.5 ounces of a spirit is considered a standard drink. So that's not typically what we're pouring in our glasses.
Almost never.
Almost never.
Yeah.
So
As a matter of fact, if somebody at a party probably pours you the recommended amount of wine in your glass, you probably look at them like they've got something wrong.
Yeah.
Yep.
I'm
Right?
not welcome.
Why are you short pouring me?
Yeah.
What message are you trying to send me?
Yeah.
Yeah. Is the younger generation replacing alcohol with something?
Yeah, there's so many different options available now in terms of non-alcoholic options. Like even yesterday at the grocery store, I noticed that there was a whole row within the liquor section on non-alcoholic options. So that's beautiful. That's one thing. But I think people are using cannabis a little bit more. They're using other substances as well to kind of balance it out, seeing that as a lesser.
More psilocybin now. It seems a lot
for
more
sure.
people using
Yeah.
mushrooms and the
Yeah.
pills and the extracts.
Absolutely. So there are different things that people are using, but alcohol is one of the ones that right now, like you said, I agree with you, Shaz. It's the one thing that I think will shift in this generation.
Do either of you have a strong opinion on psychedelics, so to speak, on psilocybins? I mean, it sort of used to be back in the day, somebody would get like a baggie of like, sort of greasy mushrooms. Nobody really knew where they were from. You'd eat them. They were disgusting. It stuck in your teeth. And then, you'd either have a bit of a trip, a psychedelic experience or not. These days, and you can get them on slick websites. The packaging is beautiful.
Yeah. People
Little
grow
pill
their
form.
own.
People grow their own.
Yeah.
Do you have a strong opinion either way?
I think we're learning more about the effect on it. And unfortunately, the research that was started in like the 70s was halted in the States. And it was actually showing some really interesting promise for mental health support, for end-of-life support. So that's where the evidence has sat, where people who are at the end of life, palliative care, the use of psilocybin has been quite remarkable for them in terms of the fear that comes into that stage of life. And that's where we've seen a lot of benefit. There are studies being done right now, like our academic hospital has a study on psilocybin, it has a study on ketamine, to look at these different alternatives, because for folks who have tried the traditional routes of what we know has worked for some but doesn't work for everybody, we need to look for other options. And so this is an area that is evolving, and we'll learn more and more to see, is it impactful? What are the actual doses? And then in that sense, we need to know it's not going to be something that's like in a paper bag or a plastic bag. We need like actual understanding of what the dosing is to see what the impact is.
Well, and ultimately, in theory, then you get to the point where you want it to be government regulated,
100%.
which means it can be either decriminalized or legalized, follow kind of the cannabis model.
Yeah.
Not that it's been perfect.
Yeah, and I would say, so I would agree. For me, I mean, it's from a recreational standpoint, right? Sheila's kind of talking about it from more a therapeutic standpoint. From a recreational standpoint, humans use drugs. They have always used drugs. We will continue to use drugs. When we look at things like smoking, back in whenever smoking started, a long time ago, it was touted as being a good thing, right? And then more data and evidence came out, and now we know that it's actually super bad for your health. Alcohol is another example of that is like behind, right? That wasn't thought to really have any negative effects, and now we are seeing that it has tremendous negative impacts on health. We are seeing this for cannabis as well, right? There are negative health impacts of cannabis, and now that psychedelics are more front and center, it will take time for us to be able to do the research to look at what the immediate impacts are, but also what the long-term health impacts are, because
Yeah.
that long-term impacts just simply take time, right? We need more people to use them. We need more people to be able to do research studies on them so that we can then follow them over decades and decades of their life to see if there are any signals that show up in terms of potential positive or negative health impacts.
Yeah, of course you two are going to give like the credible, well thought out answer, which is why people listen to you, why people trust your podcast. I will say as a civilian, so my opinion here should be considered the least. No one should ever take medical advice from me or anything along those lines. I'll also note that technically mushrooms right now are illegal.
Yep.
Like that should also be noted. And so that means that whatever source you're getting them from, should be questioned. But I do hear from a lot of people that say they feel better. There's no real hangover. They're happy to like pull out alcohol out of their lives. A lot of people, like you talked about from a therapeutic standpoint, living with mental health challenges and the like, are doing what they call microdosing, which is, not getting all mangled all the time, but just, getting their brain to a point where it's functioning better for them. And these are the things that encourage me, or at least make me feel like this should be further investigated.
Yeah. Well, I think the public's using it, and so that means that we need to follow suit and do the appropriate studies to make sure that we can do this safely. And right now, I think people might be guessing a little bit as to like what dose is right, what do I do, and there's a bit of experimentation happening, and that's tricky because we haven't been able to guide our patients through that.
Our feature, go ahead.
Sorry, the only thing I would add, because you alluded to this, is that because there is no regulated source of this, you don't know what's in them, right?
Totally.
And so, when we talk about any sort of unregulated or not yet legal substance, you don't know what you're putting in your mouth. And certainly there are lots of things out there that are said to be one thing and then often contain opioids, something that you and I have talked about before that can have significant negative health impacts, right? So it's just important for listeners to be aware of that as well, that yes, there are benefits, but it's when it's an unregulated substance, it's really hard to know exactly what you're getting.
Absolutely true. Absolutely true. Our feature interview today, presented by Mercedes-Benz Edmonton West, The Best or Nothing, with Dr. Shazma Mithani, an ER doc out of Edmonton, Dr. Sheila Wijayasinghe, a family doc out of Toronto. A couple of stories across the country right now making news, and I think these are unnerving to anybody. A popular Calgary restaurant believed to be the source of an E. coli outbreak that's seen at least 4 days ago, nearly 70 cases, which is obviously pretty significant. Also a salmonella risk. Pistachios, baklava, the popular Greek treat containing pistachios, recalled by the Canadian Food Inspection Agency, CFIA, over a salmonella risk. These stories always freak me out. You go to your favorite restaurant, you always think everything's going to be completely fine until it's not, or you pick up something, you're good enough to check the expiry dates at the grocery store, it looks fine, turns out it's not. You guys are doctors, you guys have families. How do you start to analyze or evaluate stories like this?
Yeah, I think that it's important to talk about these things, and important for consumers to be aware that there is always a small risk of contamination, but small is the key word here, right? When we think about the vast majority of foods that we consume, groceries that we buy, restaurants that we go to, the risk is still relatively low. And although it is very important to have awareness, and then, we can certainly get into symptoms in terms of things to watch for, that in general, we are lucky to live in a country that has really good food regulation guidelines and grocery regulation guidelines, that we have the privilege of being able to have access to safe food.
How did this is probably maybe a bit of a difficult question to answer when you ask how does something like this happen at a restaurant, but maybe if we frame it as what should people be considering when they're bringing food into their homes? Are there best practices that maybe even the two of you do on a regular basis to protect yourselves and your families that you advise your patients to do?
Sure. Our family's on a bit of a pistachio kick right now, so I'm very aware of this outbreak that's happening.
I could eat my body weight in
right?
pistachios.
It's like a big thing right now. And so, right now on Health Canada's website, for everyone who's listening, there is a list of the products that have been listed as having potential contamination. So I encourage people to look at that list. And then you can choose accordingly. We're not telling people that they should be throwing out all their pistachios. They're expensive, but it's also one of those things to look for that list and then choose accordingly. And then we know that salmonella in particular is a foodborne illness. So if you have symptoms, you should not be preparing food for other people. It's actually an illness that can last in the system for a few weeks, even without symptoms. And so if you had a bout of diarrhea or vomiting, you want to maybe avoid cooking for other people in that time, just so that it's not spread to food, and then that's how they're getting it into their system. It's different than like the flu or a cold in that you can transmit it through the air. It's actually through food consumption that we're getting that. And so proper hand washing is really key in this situation. So if you can't help but prepare food, you need to wash your hands. So washing hands regularly in all situations, especially before food preparation, cooking your food thoroughly to make sure that it is well cooked through. That's also a way of reducing that risk. Not having expired products as well in your home. So using this as an opportunity. I always tell my patients, I'm like, this is an opportunity to go through your closet, look through your pantry and see what's expired and what's not. Also on the side, check your medicine cabinet, make sure your meds aren't expired. On the side, you're doing everything in your house. Why not do everything? And then just make sure that you're being as safe as possible in that situation.
We had this conversation literally this weekend. Different personalities come at it differently. I mean, there are hard expiry dates on some things. There are best before dates, which feel more like suggestions. You as physicians will cringe when I start, talking about my personal perspective on yogurt, which is the
smell test for
yogurt for me.
I agree.
I don't want to put a time on it to give somebody bad advice, but let me just say I have a lot of flex room when it comes to the best before date on yogurts. But in all seriousness, I'm the type of person that likes to have a lot of everything. So I like my medicine cabinet to be absolutely full of everything anybody could possibly need. But deep down inside, if I know that Robaxa set is from 9 years ago, or that Advil cold and sinus probably doesn't even work anymore because it's from wherever ago. Still with things too like flour and cinnamon and things that can sit in certain dry pasta noodles you wouldn't use forever. But I've had to really, my soulmate here has been very good on this with me and forcing. As a matter of fact, she just picks it up the initiative and does it herself. But going through it, I find it honestly from a person, there's probably some deep personality stuff there, but I find it difficult to throw stuff out even if it's past its expiry date. I don't know. I'm a hard one to get through to.
And I think that's a really important point because yes, expiry dates are important, but then there's also the balance of food waste too. And we know that, and there's again good data to show, and lots of kind of investigative journalism and stuff that's been done on this too, where the best before it is a best before date, right? So it doesn't mean that after that date it is unsafe to eat. And
it's not a bad after date.
Yeah, it's exactly. It's not a bad after, it's a best before. And so things like doing the smell test, I think, are important. Looking for if there's something green and fuzzy in there, obviously don't eat it. But for the most part, things are there is some flexibility there. And when manufacturers are putting best before dates on products, it's more to err very much on the side of caution and safety versus the balance of the food waste part of it too. So I'm with you on that, on most of those things.
I learned, and again, I would recommend anybody listening to this podcast listen to the doctors, not to me. But I learned a tough lesson. It was a couple years ago. I remember preparing a meal for some guests at our home, and I saw panko breading, kind of the tempura style, those that really it really can really elevate a dish. But it had long expired, and I knew it. And I tried to get away with using it. And actually, it'll surprise you. The veteran culinary aficionados in this audience will already know this. But actually, if you use expired stuff like that, you'd think flour can't go bad, but it most definitely can. Yeah, and it takes on this horrific kind of a stale taste. Yeah. And trying to get away with the panko breadcrumbs burned me, and the food was unservable. And I think we ended up ordering, but no, it was a good one. Do the two of you do you buy into if you see the pre-washed salad at the store, when you come home, will you still wash the leaves again? Do you trust what you read on packaging? When I hear things like E. coli, Salmonella, I think of lettuce and things like that.
Yeah, I still wash everything.
You still wash everything, even if it says pre-washed on the package? Mm-hmm. Yeah, I'd be curious to know what percentage of our audience would.
Sometimes.
That feels like, I think, an unofficial, unscientific Twitter poll. That'll be mine. I'll put that out today.
Okay.
Do you wash pre-washed lettuce?
That's a good
question.
I'm really interested to know the results of that.
Yeah, you spent the last, Shaz, few days on the Hill, Edmonton's iconic folk music festival. Weather, a little bit hit or miss through the weekend, but we haven't really had, and I want to be careful what I say, because I know that many communities across the country have been greatly impacted by wildfire this season, so to speak, this spring into summer, including many First Nations communities in the northern part of Alberta that aren't getting as much attention. But generally speaking, the air quality for the past month or so has been quite a bit better than this time a year ago. Do people still need to be concerned about being outside, what they're breathing, air quality, paying attention to the air quality index? Is that something you advise people to do on a daily or weekly basis?
Yeah, I think it's still important to look at that every day. I mean, in Edmonton in particular, which is where we are, I agree, compared to a year ago last summer, air quality is significantly better. It is still a habit of mine to check every day. One thing that's important for listeners to note is that you can't just tell based on what it smells like outside what the air quality is, because it's not just smoke that is impacting air quality. There are other pollutants that can be in the air that you can't smell that could have a negative impact on air quality. So it is still important to check every day, especially if you're someone that you or someone in your family has potential risk factors or lung diseases or heart diseases that could have should have a lower threshold for what's safe for you to be outside.
That's definitely not on my radar. I feel like I do the smell test for air quality. That's kind of it for me, right? It's like unless your eyes are burning or it reeks,
that's what most
you figure
of us
the air
do.
is fine.
Yeah, but it's good to check online and see, especially with those folks who have those conditions.
Are both of you like when you woke up to face the day today? Did you put on like SPF facial cream? You're nodding your head?
Every
Yes.
day, Ryan.
You're saying to me
just
what
started.
you just started?
Honestly, I grew up in a home where we were just like,
You're
going to
meet us where we're at.
Yeah, we just didn't do it. And so I didn't learn to do that regularly. And then when I was growing up, I'm also a child of the 70s. I was like, we didn't have colors for my skin. And so I would wear the sunscreen occasionally, but then I'd be like, this isn't really cosmetically what I want to do. And I didn't, it wasn't an issue for my family. And so it wasn't something that we talked about. But now, now there's like the clear sunscreens that work
or
really
like
well.
that have a nice tint to
It has
them.
a nice tint. So yes, so now I have started, and my kids are definitely going to be on that. My husband's very see-through, so he he's pale.
Same with mine.
So he's definitely, it's a part of our lives now.
For you, is it like for me, I know my dad had like a spot removed. Turns out it was like a small skin cancer thing, and isn't it weird how we sort of, well, maybe not you guys are doctors, you probably see it completely differently, but when you hear of like melanoma or people have like a small dot and you go, oh, it's cancer, and you're like, oh, that's a good thing you got it removed, but you would never, if that person said they're like a cancer survivor, I would probably go, like, even though they are, but you're like, it's like, and this is wrong. I know it's wrong. I know people die from this stuff. Like, I'm not trying to make light of it. I'm just saying, like, I feel like society as a whole, the general population doesn't really take skin cancer as seriously as like all the other cancers.
Melanoma is one of the cancers that I'm the most scared of.
Yeah.
Really?
Yes, because it is like, I mean, now with like new immunotherapies and stuff, it can be better treated, but it is like historically one of those cancers that can be very invasive, can spread very quickly, can spread without knowledge, like, because you don't really get symptoms until it's too late, and extremely challenging to treat. Like the 5-year survival rate historically has been very low. I will caveat that with now there are lots of kind of specific gene and immunotherapies that are coming out that increase survival, but it is definitely one of those cancers that I'm the most scared of.
Yeah, I've had patients pass from melanoma.
Is that right?
Yeah.
At young ages
from
too.
malignant melanoma. And that's probably where my shift happened for myself, where I'm like, I also need to be aware of this. And we do see folks with darker skin tones tend not to use sunscreen in the same way. And that's a population that is still at risk of skin cancers. And so definitely something to consider. When patients tell me they're not so worried about it, then I take it from a different approach of like, it's also anti-aging. Like everyone is investing in skin masks and all of these different things, but the number one thing that we know that actually helps with skin and aging in particular is sunscreen.
Yeah.
So that's the other way I get around. So I'm like, if the melanoma route doesn't work for my patients to wear sunscreen, I'm like, well, what about you
just want to look young
forever.
forever. You want to be beautiful.
And it works.
You want to stay beautiful.
Yeah.
That's right. Matthew, I think this was timed sort of with our conversation in our live chat powered by Park Power. Matthew says, I'd love to hear the doc's advice just on sunscreen usage. He says, like, should I be using it like for my walk to the LRT, to transit? Should I be using it for other short spurts outside? He says, is the 2-hour reapplication a hard rule? These are good questions from Matthew.
Yeah, so I put sunscreen on, for sure, my face every single day.
What SPF do you use on your face?
I use 30.
Okay.
Yeah.
That's the minimum that you want to go for, is an SPF of 30.
Yep, so minimum 30. So yeah, every day, no matter where, even if you're in the house, you have to remember that like UV radiation comes in through the windows as well. So it's not just, I mean, like if you have an office that has windows, if you're going out to like get the mail or go take your dog for a walk, going to the car to get groceries or get your kids, like all of those things are UV exposure. And even when it's cloudy, there's still UV exposure. In the winter, if you're skiing especially, right, because the reflection back, if you're near water because the reflection back, those are higher intensity UV times. So it's not just when it's hot outside and sunny outside. It's not just in the summer. Full year round, I always put SPF on my face. And if I'm
year round, really, like in the middle of December?
Every day.
Okay.
Every day. And in terms of the reapplication, so every 90 to 120 minutes, or if you're sweating intensely or in water and swimming, then the reapplication would be more frequently than that.
We got a bunch of questions. People are just asking about if those daily moisturizers that have SPF in them are adequate daily protection.
Generally not. So I used to get away with just putting makeup with SPF in it, and that is not enough to give you coverage. So the daily moisturizer are a good step. So often what I'll tell my patients, I say first thing in the morning when you wake up, put that layer on your face, especially because that's an area that we ignore. The face also includes the neck. So do both the face and the neck. And makeup or daily moisturizers don't have enough sufficient protection.
Or you're typically not putting enough of it on. That's the problem, because you need to have, I mean, it's about a teaspoon for your entire face, or like a finger length for your face, and then 2 finger lengths for kind of your head and neck. Is what is typically recommended. And so if you're putting makeup on, that's usually not enough SPF. You'd have to really put a lot, like SPF makeup on, you'd really have to put a lot of it on. So
you have to go like 1980s makeup application.
Yeah. So putting on just like a clear SPF or something underneath your makeup is going to be a lot more effective.
80s Fanify says, always remember driving exposes you to a lot of UV rays.
100%.
I remember one of my dad's buddies driving back from, I think they had a place in Shoe Swap like years ago. It doesn't matter what he drove, but just for the benefit of the audience, he had a 64.5 Mustang, beautiful old Mustang. But I remember he came back, and when he arrived in Calgary to drop off my brother, and he had been driving the whole time with the one arm out the driver's window, and he had like a horrific sunburn, like a really significant sunburn on the one arm. That was it. I remember this was like 30 years ago.
This is where we see most of our skin cancers, is on this arm.
On the forearm?
Because it's like the driving arm.
Yep.
And so that's where, if you're going to put it anywhere and you're driving, put it on your arm if you're going to be having it right next to that window too. Yeah,
totally. There's actually this image of a truck driver later in life floating around that people could easily just search for. But the driver's side window, so like the left side of their face compared to the right side of their face, much more wrinkled in age, because they were a lifelong truck driver, always exposed to more UV on that side. And you can see a noticeable difference between both sides of this person's face. There's some twin studies that look at that as well, like SPF in identical twins. Using
look at what we're showing on the screen right now.
That's
so
exactly the one that I was thinking of.
We'll reference cbsnews.com. But for people listening to this on the podcast, you can describe what we're seeing here.
Yes, you can see on the left side of this individual's face, like very wrinkled. You can see that the skin, like the texture is different, that it looks...
That's
it is like a noticeable difference versus the right side of the face that is much smoother, less wrinkled, less aged for sure.
It also looks like it has a basal cell right underneath his eye there.
I can see that.
Like a type of cancer under his eye.
Is that something you can, I mean, you'd obviously want to have that tested, but you're almost like looking at that. Have you ever had this before? You heard this story? It happened in like the National Hockey League last year. Or was it 2 years ago? Johnny, do you remember this story? It was like a gal that was sitting in the, she was a fan of the team. I think it was in Seattle maybe. And she looked and she saw that the trainer on the team had a spot on his neck, and she let him know, and it ended up being cancerous, and he had it removed. And like, is that the type
sometimes
of thing?
I'm out and I do see people, and if I feel comfortable enough, I will sort of be like, that's something to check out.
Yeah.
I do it very graciously, and like, is it okay if I say something? But I do see this, like the person that was on that screen there, that looked like a concerning feature. And the good news is that we can actually intervene fairly early. There's great treatments, but even just removing things with good margins can be curative for many people.
Yeah, it's and then you sort of go, well, oh gosh, for me, it's probably too late. You're going to say it's never too late,
never
right?
Too late.
It is
because I just started myself.
Yeah.
So I see this as like never too late.
I feel like it's got to start today. Tony, by the way, kicking in $5 in our super chat. This is typically how people can buy guests a beer. In particular, guests that joined us in studio right here in the historic Mercer Warehouse in downtown Edmonton. But Tony, on purpose, I like this, has stipulated. You saw the big beer fridge when you walked in. Maybe you can go help yourself. But she says, how about a contribution here to a couple of nice fizzy waters for the docs? She says, what a great way to kick off the week with these two excellent guests.
Oh, that's so nice.
We do have a number of different flavors flavored sparkling waters in the fridge if you'd also like to help
thank
yourself
you.
there.
Love
This
it.
is probably a good time to let the audience know as well. I'm really looking forward to this week of shows that we're doing. The two of you today, rock stars, and then Dr. Mark Tyndall coming up on our next episode. That's, of course, going to be the 12th of August. We'll be talking about vaping. And then on the 14th, on the Thursday, a Real Talk Roundtable. I have it, casually slated in as our booze roundtable. But we're going to be talking about, and we're talking about like tariffs and the business of booze and interprovincial trade barriers and the like. We'll have a wine rep, a liquor rep, and then a pre-mixed cocktails rep that's joining us. Here's why I'm bringing this up to the two of you. I was talking to her. Her name's Carly. Everyone will meet her on Thursday about the mocktail business. So her business is called Clink, and she's going to join us on Thursday. They make like full booze drinks. Like they make a really nice mimosa. They have some sort of like a raspberry lemonade type thing, and then they make the mocktail equivalents. And I asked her. I said, "So what do your sales look like? What proportion are they? Like 50-50, this, that, and the other?" And she was telling me, I don't want to spoil it. She'll tell it on Thursday, but here's what I thought was really interesting. I said, "What's one thing that surprised you about being in the mocktail business?" And she said, "There's a lot of people." She said, "There's definitely a real market for mocktails and alcohol removed beverages, premixed drinks, and the like." She said, but she's heard from a lot of people that are like in recovery, alcoholics that still want to have something that they can enjoy socially, whatever. She said they've had to be careful as a business not to get the drinks to resemble alcohol too much from the taste profile, or you can trigger people that are in recovery. She said they've had specific customer feedback. People have said, your mimosa tastes too much like champagne, which I thought was really kind of interesting.
Yeah. No, I think that's a really good point. I mean, there's a non-alcoholic cocktail bar here in Edmonton called Spilt, which I've been to before, and it like specifically specializes in NA cocktails. But in talking to one of the co-owners, Joe, when her and I have talked about it, she said exactly the same thing, that people come in and she has to be careful about a couple of things. One, the flavor profile and how similar it is to a beverage, or sometimes there are things that are low alcohol or a tiny bit of alcohol, like bitters often have a bit of alcohol in them, right? Or de-alcoholized wines or beers will often have a little bit of alcohol in them. And people who are sober won't even have like a little bit of alcohol in anything, right? And so that was another thing in terms of a learning curve in understanding even a little bit of alcohol in the flavor profile or whatever is still not okay.
Yeah, so true. This is a great note from Shirley. She says on sunscreen, she says, "My non-gloved golf hand is way more wrinkly than my gloved hand." She says, "Who knew?" Very fascinating.
Our hands need sunscreen too.
Oh my gosh, that's something I feel like this is why we bring you on. You guys might literally save someone's life today. I'm saying, do you ever think about that? Every podcast episode you do, every media appearance that you do, whether it's on the social or with us or wherever else.
We certainly hope so.
Yeah, I've had messages from people. They're so beautiful when people write us on social media, especially with the social work. They sort of like said, "I went and had that mammogram," or "I did something," and that is like, if one person listens and gets that support, that's the goal.
Okay, well, I'll tell you what I'm going to do. I'm going to make you a promise, and I mean it today. Johnny, prep the music bed. Here we go. When I head out to the Ranch Golf and Country Club today to play 18 with my pals, I'm going to put sunscreen on. I promise you this. I promise you this. That's right, friends. I'm going to be out at the ranch. This is Alberta's #1 public course by a mile, if you ask me. This is my home course, and say no more. We host our Real Talk Golf Classic out at the ranch every single year for a number of different reasons, not just the fact that it's a premier course right on the outskirts of Edmonton, literally 22 minutes from the downtown core, but the ranch is also laid back and accommodating public golf course. If you're one of these that believes the game needs to be shrunk, ranch may not be the place for you, but if you have a blast out there swinging the sticks, socializing, listening to a little bit of music, and celebrating those once-in-a-lifetime shots, those beautiful shots that just bring you back, you're going to love a day out at the ranch. Nobody does more tournaments in the Metro Edmonton region than the ranch does, and you'll find out why when you check out their website. That's theranchgolf.com. You work with Murray, Adam, and the team from tee-off. A warm welcome from the starters all the way through to the steak dinner. Their culinary team, second to none. Nobody does it better than the ranch at theranchgolf.com. A shout out to those of you that are getting ready for your next semester at Athabasca University. That's Canada's Open University. The beauty of this if you're hearing this for the first time and you're going, gosh, I feel like now's the time to go get that undergrad or maybe an HR diploma or maybe an MBA, whatever it is. You don't have to scramble to be ready for the day after Labor Day when all the other universities are kicking off. As a matter of fact, just one of the reasons why AU has more than 50,000 satisfied program and course alumni from over 100 countries is its flexibility. The fact that you open up your options with their online offerings. There's no commuting to a brick and mortar university. You need to press pause on your studies. Heck, you want to fast forward through them? You select your path. You can learn more about how AU works by visiting athabascau.ca. And how can we talk about helping people? How can we talk about building healthy communities without shining a spotlight on UCAN Youth Services? This is a nonprofit charitable organization that's helping young people out of harm's way and onto a path of economic independence. They do that through a number of different programs. You can read about them on their website, ucan.ca. I'm looking for folks, those of you that have a young adult in your life, let's say they're between 12 and 17 years of age, continually in trouble with the law, or maybe they're between 18 and 24 and they're just not really connecting with a workplace. Maybe they've bounced in and out of school but never really found their fit, but you see the potential in them. You know that all they need is an opportunity. Enter UCAN. That's right, ucan.ca. You can learn more about their relentless outreach work, their road to work programs, their job placements in the construction industry, game-changing advocacy from Katie and her team at UCAN. Again, find them online at ucan.ca. So much fun hanging out with these two, Dr. Sheila, Dr. Shazma. I wanted to touch on something. We're not quite at year in review phase yet, but when we are, we'll look back on our May 13th episode. This is when actually a longtime broadcast colleague of mine joined me to talk about something we had never discussed before. Jessie Shutuk talking to us about the menopause mission and her advocacy when it comes to menopause, perimenopause as well. I had no idea that episode would land how it did. We heard from audience members that had never heard of Real Talk before. We heard from audience members, men and women of all different ages, that talked to us about how this prompted conversations in their households. And I think it was, for me, a real wake-up call that there's a lot more we can be doing when it comes to, hosting or facilitating conversation on important subjects like this.
Yeah, when it comes to perimenopause and menopause in particular, it is something that I'm so glad to see is being talked about more and more. In general, women's health, anything women's health related, whether it be different cancers that specifically affect women or different life stages and changes that affect women in particular, have been underrepresented and certainly under-researched. Even the way that different health conditions that affect both men and women, like heart attacks, strokes, cancers that affect both sexes, again, most of the research is done on men and then applied to women, when we know that women's bodies just act differently and present differently. And so I'm really, really glad to see that we're having more conversations about this, that we're raising awareness about how women's bodies are different, women's experiences are different, and also promoting or kind of pushing for more research on women in particular.
Kind of a theme of a lot of the feedback that we got back from that. Maybe you hear a lot of this in your family practice, or maybe you nip it, maybe you spot it right away with people. I don't know. But a lot of women were writing in to say, like, the biggest thing for them was not understood the symptoms, or having not a real clear direction on why they were. All they knew is that they were feeling these certain things, but they didn't know why. And as soon as they had heard of perimenopause or read a bit more about menopause, all of a sudden you get that clarity, which probably happens quite a bit with diagnoses.
So much, so even for us as healthcare providers, menopause and perimenopause was never discussed. And I graduated from U of A in 2004 from medical school, and I was of the generation of physicians who were told, don't even ask about it because we don't have something to even offer our patients, because of a large study that really shifted how we treat and support our patients in 2002, the Women's Health Initiative. And what's happened is that for this last 20 years, women going through this stage of life were left without options. The good news is, so I've now become certified to provide menopause care. It is a large part of my practice. I speak on this regularly, and I normalize that this is something that we can support you through. You're not alone in experiencing these symptoms. They can be incredibly debilitating to go through, menopause being a time when your ovaries stop producing estrogen, and so they did the loss of that estrogen effect on the body affects your mood, your sleep function, your brain. People get brain fog, they get hot flashes, they don't feel like themselves. What was happening to me, Ryan, was at school, when at drop-off, moms would come up to me and say, I know you talk about this. I don't recognize myself anymore. I don't recognize how I'm interacting with my kids, with my workplace. We're hitting, like, this is a peak of your life, right? In the sense of, like, you're in the middle of your career, you're taking care potentially of children of different ages, you're caring for your aging family members at the same time, while also in your 40s and sometimes in your late 30s, you start to have symptoms of perimenopause. You're then vulnerable to the changes that can affect you physically and emotionally. So it's it can be a very challenging time for people. So I'm so grateful that this is part of our conversation that we're having, to acknowledge it, normalize the conversation, understand that there are opportunities to intervene and support you through lifestyle, medication, or otherwise that have really good evidence behind them. People are taking advantage of this space right now online and selling all sorts of supplements and quick fixes and tests to take when you go through. What we do in our office is that based on your symptoms, I can diagnose you. Certainly I have to test for other things, but really it's a clinical diagnosis, meaning that you tell me that you're feeling this way, you're of a certain age group, this is likely perimenopause. And acknowledging that is really therapeutic for our patients too. So I love this topic. Chaz and I are hoping to do something of like a chat coming up in Alberta sometime in the next year to actually talk about this, have an event to bring women out from Edmonton and area to really like have a candid discussion.
Oh, I think you'd pack the house.
And we would this is something that we really want to do.
Yeah, and I think to Sheila's point, well, a couple of things. We do have an episode from season 1 on perimenopause and menopause, so please listen to that because we really go in depth. I learn a lot from Sheila on that as well because she is an expert in the area. But I think one point I want to highlight, Ryan, is, misinformation and disinformation is a space that I speak in a lot. Often. And this is a space where women in particular are taken advantage of by health and wellness coaches, people who label themselves as experts in menopause without any actual training and sell different supplements that are not evidence-based, take advantage of the vulnerability of this time in women's lives, and try to sell them things that are not evidence-based, try to sell them testing that is not evidence-based. And it's an ongoing issue that's getting worse and worse, unfortunately.
Your episode, by the way, Is It Perimenopause, was released on November 25th of 2024 for anybody that wants to check it out there on the Doc Talk podcast. We're talking to the co-hosts, Dr. Shazma, Dr. Sheila, in our feature interview presented by Mercedes-Benz Edmonton West. You must see get some insights or take a look at some analytics on who's listening to your podcast and where they're listening from, and that interesting kind of stuff. We do the exact same thing. Always thrilled when we see new audience members from different parts of the country and that sort of a thing. We've had some fun conversations on ChatGPT and AI and who will be replaced by what, and which jobs will be the most impacted by AI. And I was talking to a buddy over the weekend. He's a realtor, and he goes, "Do you think that realtors ever be replaced by AI, by ChatGPT?" I said, "Well, I don't know." I said, "But I'll tell you, if I was like a real estate contract lawyer, if I did contract law, for example, that might be something I'd be looking over my shoulder." WebMD has been around for ages, and I'm sure that obviously it's been a valuable resource for some people. It's probably also convinced some other people either they're fine when they're not, or they're not fine when they are. Do you ever see, or are you already seeing things like ChatGPT replace physician visits, people seeking diagnosis from AI and that sort of a thing?
All the time.
All the time?
All the time. People are going online. And listen, like some of the information that's given is quite good, but we just don't know what's evidence-based and what's not. They're getting better, I'd have to say. Like some of these ChatGPT options are quite good in the sense of like giving a basic overview. I don't think at this stage that it's replacing us, but it's interesting. The challenge is that it's not always accurate. That's the biggest challenge. And it can also be fueled by this misinformation and disinformation, the strong voices out there, which is why, again, we're trying to do what we're doing and sort of putting more information out there that is evidence-based to kind of counter that. But you see it probably in the Emerge, as I certainly see it in primary care.
Yeah, I see it in Emerge a lot. And I think to Sheila's point, yes, it is getting better. But the caveat of it's still like OpenAI and all of these kind of AI chatbots are still getting information from the World Wide Web, right? And so if that is where the information is coming from, there is a risk of not so good information, misinformation, disinformation, making it into making it into whatever narrative is being put towards the patient that's looking things up. And so, do I see AI as an adjunct in medicine? Absolutely, yes. AI Scribes is something that Sheila brought up before. There's a great program called Open Evidence that just was recognized by People magazine, I think, where it only pulls from certain sources of information, and it's meant to be a tool for healthcare providers, where it collates the evidence on a specific question that you're asking and gives it to you in a very understandable way. So there are great strides that are being made with AI in terms of being able to complement and support medicine. But I would still, from a patient perspective, still approach with caution, because the context of what a patient is presenting with, other historical factors that may not get put into the question that's being asked, physical exam things that certainly an AI chatbot cannot do, those are things that can still put patients at risk of having misdiagnoses or avoiding seeing a doctor when they should, and being falsely reassured by things.
Right. Daniel Nadler, is it Nadler? Nadler is the founder of what they're describing, like you were talking about, Shaz, the chat GPT for doctors, Open Evidence. Here's the feature in Forbes.
Forbes, thank you.
He's raised $210 million at a valuation of $3.5 billion. That's just another example of something where you go, gosh, that just makes sense.
Yeah.
If someone would have thought of Facebook. I guess someone did think of Facebook before Zuckerberg, but I digress. Record keeping, charts, filling out charts, like just the day to day, you as a family, like your physical posture just changed when I brought that up. Tech can be a great thing.
100%.
Obviously, doctors are human.
Totally. And I think we really want to take our time with our patients. Like, that is my goal, is to see as many patients as I can, to give them the time that they need. Paperwork takes away from a lot of that. So we know, especially for family doctors, paperwork is a large source of their burnout. And so if we can minimize that in different ways using AI Scribe. So AI Scribe is something where we get permission from our patients. It sort of listens in on the conversation. It erases the conversation. There's no identifiers on it.
Right.
But then it summarizes our visit for us. I go through, make sure that it's not inaccurate in any way. And then it saves me an hour and a half of work every day to use this.
An hour and a half.
Yeah,
Wow.
so that means that I can see more patients. I feel less burnt out. My favorite part of doing my work is to talk to my patients,
Of course.
not typing and figuring this out or writing a letter or those things, which are part of my job. But if I can make that part easier, and that's where I think if we can engage with AI in a really productive way, we're going to be more effective. But we just have to use the cautions that Shaz had mentioned. And there are some AI tools specifically in the menopause space I can speak to that are actually only pulling data from the major international societies that provide evidence-based information. So when a patient goes onto those sites, they're actually quite trustworthy in terms of, I'm having hot flashes, what can I do? And it says, well, according to the Menopause Society, this is what you can do. And that's super helpful, I think, in terms of accuracy, evidence-based. But it's just the general tools right now that we have to use some caution. But there's great potential.
Absolutely.
Interesting comment here from Mariah in our live chat, powered by Park Power. She says, my friends and I were actually discussing this recently, about the pros, cons around AI in medicine. She said one of the pros that we imagine is that it could remove the bias that women and minorities may run into when seeking treatment.
Yes, but also possibly no, right? We know that there have been plenty of examples of ChatGPT having bias in answers that it provides, right? So again, it is gathering information from the World Wide Web where bias exists in those sources of information as well. And so there have been plenty of examples where, whether it's because of gender or race, that there has been discrimination put forth by ChatGPT. So yes, with that caveat.
And because a lot of the research that has been done have been done on a specific population. So older men over the age of 65 who are Caucasian, and which doesn't necessarily then apply to the rest of the population. So if we're applying that as, I'm a 47-year-old South Asian woman and I put my information into this, the information that's coming back to me may not apply to me, which is where that nuance has to come in with your own clinician to kind of make sure that your needs are being met specifically.
Yeah, we're getting a lot of talk about prostate cancer, PSAs in the chat as well. A bit of a curveball for you. Some real talkers are lobbying for me to have a prostate exam live on the show, which could be interesting. I will sit right here, right now. Actually, for my annual, and I'm only saying this in somewhat of a facetious, boastful tone, because I finally was able to get a family doctor again. I went I know you as a personal friend of mine, you're going to shake my head and tis me. You too, Sheila, that's fine. fine. I went like probably 4 or 5 years without an annual because just some complications. A family doc left the practice, and et cetera, et cetera. And so I was thrilled to get back. Weird, weighed a little bit more than last time. Weird, yeah. But my doctor was telling me, he said, he's sort of, we have a history of prostate cancer in the family. My grandpa battled it for years and years and years. It was detected in my uncle early. He beat it. It's always been on my radar. So I've had a number of prostate exams and have always encouraged, in particular, the men in my life to be responsible with that. Make sure you try to get your annual and the like. My doc was telling me that it's changed quite a bit, and gone are the days of basically like the digit up inside. Like there's all different kind of ways to do it.
Yeah.
Is the recommendation still every year after you turn 40 for every single guy?
No. So even checkups yearly have fallen out of favor.
Really?
Yeah. We recognize, again, science evolves and the evidence that we have changes in terms of when do we see people? How frequently do we see people? When it comes to prostate examinations, doing it routinely has fallen out of favor because it hasn't been found to change what we do and the outcomes for patients, unless we do an exam if you have symptoms. So if you're getting up in the middle of the night to go pee, if you're peeing more frequently than usual, or you have any concerns with urination, then we should be looking at the prostate in men, right? So to make sure that it's not enlarged, do we feel any nodules? But a digital exam doesn't really see the whole picture, because we're only getting part of the prostate as well. So if my patients have symptoms, I certainly do an exam, but I'm often also doing some imaging just to see like what else could be going on in the areas that I can't reach with my finger, right?
Got it.
So it's not necessarily an annual thing anymore at all. It's actually with symptoms.
Okay. I like this from Jillian. She says the first thing that AI will do to actually end humanity is start giving us bad advice, like drink a little bit more and forget about the sunscreen. Jillian's been with us through the whole conversation. You knew we couldn't sit down, welcome you in studio to the historic Mercer Rares without getting at least a little bit political. But I do think that this will be of interest to the audience. I do think it's an important story. The Alberta government, here I'll reference CBC's reporting. This is Jack Farrell with the Canadian Press, as a matter of fact. The Alberta government, Danielle Smith's UCP, appealing an injunction of a transgender health care law. The judge ruled that the law raises charter issues. This is back in June. So basically, Alberta appealing a temporary injunction of a law that bans doctors from providing gender-affirming care to youth. The judge here, this is Alison Coons, Court of King's Bench Justice, back in June ruled the provincial law, raises serious charter issues that should be hashed out in an ongoing court challenge of this legislation. Said the judge that it would likely cause irreparable harm to gender-diverse youth. Says she didn't find the contrary evidence submitted by the province to be overwhelming. Meantime, the province, arguing that the injunction was premature, says that the judge made a mistake. These are government lawyers mixing, quote, fact and law in deciding that the legislation would cause irreparable harm. Justice Minister Mickey Amery, by way of his press secretary, said that the law was passed to protect children from making potentially irreversible decisions about their bodies. Obviously, this is a very hot-button issue. More people have opinions than are personally impacted by this, that's for sure. The Justice Department vowing to continue to vigorously defend Alberta's position in court. Your thoughts?
So the first thing I'll say is that we know, and the evidence shows, that gender-affirming care is life-saving. Period, full stop. That is what the scientific evidence shows. And as physicians, as healthcare providers, we follow the evidence. I'm certainly happy to talk about this a little bit more, but for me, the concern is more broad than that, that when we talk about providing care for patients, the physician and the patient and the discussion between them in the context of the scientific evidence is the most important thing when it comes to making patient care decisions. There is no room for politics. There's no room for people who are not experts in the science to be able to have an opinion on how Albertans and beyond are treated with their doctors. There's no room for politicians in the exam room, essentially, is what I'm trying to say. This is talking about gender-affirming care, but it is a very slippery slope. Like, yes, this is not an issue that affects the majority of people. However, we know that the healthcare budget is expanding, and because of an aging population and more utilization of healthcare resources and a lack of primary care, things that you and I have talked about before. Who's to say then that the government can't say, okay, well, now this sets a precedent for government getting involved in healthcare decisions. Well, knee replacements are too expensive, so we are going to pick and choose who gets access to knee replacements. You have to have X number of years of physiotherapy first. you have to check all these boxes first before you even have access to be able to have a knee replacement, or deciding who gets to have one and who doesn't. Oh, maybe this person's too old to get a knee replacement, so government says no. Access to,
That's already kind of happening, isn't it? Like you can age out of being. I don't mean to derail the point you're making.
I mean, like, so
but
yeah,
you
like
can
there are
age
other,
out
yes,
of
but those are decisions between a doctor and a patient.
Okay.
Not without any sort of external interference, right? These are on, like, anytime a surgery is considered, anytime a medication is considered, there's a conversation between a patient and their healthcare provider to go over the pros and cons, look at the evidence, what direct impact, Sheila talked about having individualized care, what impact that medication or that treatment is going to have on you, and what the potential consequences are. And then everything in medicine is weighing risks and benefits. Is it do the benefits outweigh the risks? Then yes, let's go forward with this with shared decision making. Do the risks outweigh the benefits? And well, maybe we take a step back and talk about other options, but it is all in the context of a patient-doctor relationship, looking at the evidence without external interference and ideology playing into it.
Remind people that this law that we're talking about came from a trio of bills affecting transgender people that the United Conservative Party government passed last year. The other pieces of legislation that are relevant to this ban transgender women from competing in women's sports, require as well children under 16 have parental consent to change their names or pronouns at school. It also changed the game on sex ed. Parents now required to opt in their children for school lessons on sexuality, sexual orientation, and gender identity. I wish our podcast listeners could see your face, Dr. Sheila. And you're not some big doc from Toronto looking down your nose at Alberta. You've spent a lot of your career, a lot of your education experiences come here in Alberta. You're from here.
Yeah.
How are you wrapping your mind around it as a professional, as a physician?
I mean, listen, I think we know there's evidence around sex education in general, but sex education in particular is also very evidence-based in terms of opt-in programs versus opt-out programs have been found to be harmful to kids, where, these are programs that are very safe, very effective. They reduce the risks of different things that we think about, right? Like infections, early pregnancies. We know that these things are really helped by proper sex education in schools that kids have access to. So it's really fascinating to kind of see this. And I think this is something that we have risk of in all provinces, because when different provinces are talking about it, there's a movement that can happen. We have to be really careful about this, because it's also a small group of people that this is affecting. And it's sort of distracting from the larger issues at play when it comes to our healthcare needs as a society. Like, we don't have family doctors for hundreds of thousands of people across the country, millions of people.
Millions.
We don't have access to care. We don't have access to medications. And then targeting the most vulnerable people in our population is awful. They are already so vulnerable to discrimination, to hate crimes, to other things. And as healthcare providers, it is protective to be able to support them without any political interference. And that is something that I hold very true in my heart. I do gender-affirming care for my patients. I see the impact that it has on their lives. They become themselves. They are true to themselves, and it's the most beautiful thing to see and be a part of. And it's really, really upsetting to see that this could be at risk.
Yeah, I also recognize that it's the type of thing that drives people apart. I see here Lauren in our live chat says ideology kills. I want to be so careful in telling this, but I had a very meaningful conversation with a real talker the other day, not for purposes of on air, but I can share general themes around it. But their child let them know when they were 12, they were going to use she, her pronouns. And for the past few years, the family's been navigating that, and with love. Interesting dynamics in their community. They're a rural family. Their daughter, is full of life and just a wonderful personality. The parents are very proud of her and also concerned about the things that every parent would be concerned about that can be, I think, exacerbated in a situation like this, around peer groups and public safety and all the things that you would worry about as a parent. And this real talker was trusted me enough, I guess, or was blessed me enough to even shine some light on the dynamics within their marriage, and how one of the parents is quite open to the idea around gender-affirming care, and one of the parents is really struggling with it. And she shared with me that that's impacting the marriage to a certain degree, and it's impacting the family. And at the end of the day, what they care about most is just showing just heaps of love to their beloved teenager. But I share that just in the sense of noting that not everybody is automatically and always on the same page.
Yep.
It's not always an easy issue. There's no, and then for some other families, it's like, oh, it's no problem at all. It was great. It was perfect. It's totally fine. You hear all kinds of different stories.
Yeah, and I think that pointing out the diversity in reactions and how different families manage things actually, for me, makes it so much more obvious that we shouldn't just be having blanket policies like this, right? Because like medical care is individualized. Family interactions and every family is going to manage these conversations in different ways. And there are, and me working at the Stollery also see that there are, unfortunately, families that are not as open as the one that you described. And, children, teenagers who are terrified to share this with their parents for fear of getting thrown out of the house. And that is literally what has happened. Like, people will come to the Emerge after staying in shelters, being on the street because they have been disowned by their family for disclosing where they fall on the gender spectrum. And so having blanket policies is what ends up putting kids in particular in this situation at risk. And then again, broader reaching implications like I talked about before.
Matt in our live chat says I had a relative, they're in junior high, recently started using they, them pronouns, using a different name. Their parents and our family are supportive, so are their friends, and they're happy. And if they're happy, nothing else matters. Meantime, Greg says spineless parents letting children run the households. Matt follows up and says we all deserve to feel like we belong in our bodies and our identities. I don't know. I just think as a civilian here, my opinion, for whatever it's worth to Greg, spineless parents letting kids run the households. I guess you also kind of get to a point as a parent where you got to make the call of the type of relationship you want to have with your child or with your teenager when they're adults, right? And I don't know, it just kind of feels to me the days of like the rod of correction, parents spanking, kids getting hit in schools, cracking the whip. They talk about how sports coaching has changed dramatically. I bet you parenting has too, generally speaking.
Yeah, I mean, I have a 6-year-old and a 9-year-old, and yes, there are boundaries and rules that we have to put in for our kids. But that being said, I am always open to have a conversation with my children about what is important to them.
Yeah.
And I want them, to be honest, I want them to push boundaries because I don't want them to go out into the world and come in contact with some adult that doesn't have their best interest in mind and not feel like they can stand up for themselves, right? So it's fluid, and it's important to be able to have a back and forth, I think, with your children and have a relationship like you mentioned where when my kids are adults, I want them to be able to come and talk to me about things and not have fear of being yelled at or demeaned in any way.
Talking about families, we got to let you get back to yours.
My 5 and 7-year-old.
Your 5 and 7-year-old. We've taken the full 90 minutes we asked for, and it has been so wonderful having you join us here in studio. It's always a treat, obviously, when Shazma can join us in studio, but to have you here as well, Sheila, we so appreciate it. Congratulations on a very successful season 1. Something tells me that there are even bigger things in store, and I just want to encourage, if you're listening to this on the Real Talk podcast, wherever you are, Spotify, Apple Podcasts, it's so simple. If you don't already subscribe to theirs, just search the Doc Talk podcast. You're looking for Dr. Sheila Wijayasinghe and Dr. Shazma Mithani. Make sure you rate that podcast as well. That really helps. Give them 5 stars if you appreciate the work that they're doing. Hang tight here. We wrap our first episode of every week with like a silver lining, a positive story. We step outside the news cycle, and I really enjoy this one. This courtesy of our friends at Solar by Kuby. You can get a free solar quote today, by the way, if you want to do something positive for the environment and for your bottom line. Why not start saving with solar right now at kuby.ca? It's positive reflections, and I love this one. from Marie, who writes in. I'm not sure the email to talk@ryanjesperson.com. She just signs off Marie in rural Alberta. So wherever you are, Marie, she says, Jespo, I just wanted to send a quick note after your recent episode with Thomas Lukaszuk. It was on the 8th of August, by the way, former Deputy Premier and former Premier Ed Stelmach, who joined us live from Arizona, by the way. Marie says, I live in rural Alberta, and sometimes it feels like people assume that we're all on board with Alberta separation or that we're somehow against the rest of Canada. She says, I can tell you that is definitely not the Alberta that I know. Marie says, I love this province for sure. The open skies, the tight-knit communities, the way that neighbors help each other without a second thought. And I'm also very proud to be Canadian, she says. And to me, those two things go hand in hand. And that's why I really appreciated hearing voices like Premier Stelmach's. Now, we're showing you the episode right now. You can find it on YouTube or wherever you get your podcasts. That's the 8th of August. She says voices like Stelmach's and Thomas Lukaszuk talk about unity, talk about finding common ground. Marie says the Forever Canadian movement resonates with me because it's about celebrating Alberta's strength and character while staying connected to the rest of the country. She says, by the way, Jespo, Real Talk's doing the same thing. You reflect the real Alberta that I know and love while supporting values that are, I think, truly Canadian. Thanks, Marie. She says, thanks for the thoughtful conversations and for giving people like me a place to feel seen and heard. I'm proud to support both Forever Canadian and Real Talk. That from Marie in rural Alberta. Well, your email made our weekend, and we're thrilled to feature it today as a positive reflection, proudly presented by our friends at Solar by Kuby. Get that free solar quote today at kuby.ca. That's KUBY.ca. Coming up on our next episode of the show, that's going to be the 12th of August, Dr. Mark Tyndall on vaping. Plus, we're going to take a look at some of the top news headlines across the country. Senator Charles Adler is going to hang out with us on the 13th of August. The 14th is that Booze Real Talk Roundtable. I feel like we've got a whole fresh angle on that after talking to these two. Interesting timing, isn't it? That's coming up. And then Max Fawcett on the Friday. That's going to be the 15th of August. Thanks for spending a bit of your summer day with us. Make it a good one. And thanks for your support of Real Talk.
Real Talk is hosted by Ryan Jesperson, executive producer Josh Dunford, technical producer John Hicks, general manager Katie Cook-Chivers, account coordinator Lauren Sterlego, human resources Lena Shepard, website design Mike Johnston, voiceover by me, Carrie Skelton. Real Talk's editorial board is Supriya Dwivedi, Ahmed Ali, Brandy Morin, Ann Castleman, Corey Hogan, Harmon Candola, Catherine O'Neill, and Chris Henderson. Member Emerita, Julie Rohr. Real Talk is recorded in Edmonton, Alberta on Treaty 6 territory, the traditional and ancestral territory of the Cree, Dene, Blackfoot, Saulteaux, and Nakota Sioux, home to the Métis settlements and the Métis Nation of Alberta. Real Talk is a relay project. For more, check out ryanjesperson.com.